Hello and welcome to this COVID-19 update for you and your community here in the Bass Coast. My first guest is Dr Renee Kelsall, Chief Medical Officer for Bass Coast Health. Renee, hi.
Hi, thanks for having me.
It's great to have you as our very first guest. Every day there are more questions about COVID-19, Renee. It's complex and it's causing a lot of anguish for a lot of people, especially those who find themselves out of work because of the shutdowns. On a medical front, the question that most people, I think, would like to know right now, how many positive COVID-19 cases are there here in our area?
So Kevin, I can confirm that we currently have 2 cases in the Bass Coast region that have been confirmed with COVID-19. In our clinics within Bass Coast Health, we've swabbed over 300 people, so only 2 of those have come back positive at this stage.
And those 2 people that have been confirmed positive, are you able to say where they are?
So both of these cases are back in the community, recovering well in their homes in self-isolation.
It's upon all of us to do the right thing, so what are those rituals that we should now really well be doing every single day?
Well, there's a lot we can definitely do every day that we can just make part of our everyday routine. And one of the biggest ones is washing your hands, and not just the mindset that we just go and quickly wash our hands, but actually take 20 seconds to wash our hands. So whatever that song is, it's going to take 20 seconds, whether it's singing the ABC twice or whether it's counting to 20, but really getting soap and water and giving your hands a really good wash for 20 seconds. If you don't have access to soap and water, then the other options you have is hand sanitizer, like we have here today. The really important thing to check with hand sanitizer, Kevin, is that it's over 60% alcohol content, otherwise it won't kill the virus. So that's something really important to check before you use the sanitizer. There's lots of other things that you can do, like we're practicing today is social distancing. So that really important message about keeping 1.5 metre distance from other people. And that applies inside and outside. We can just be more mindful of that when we're out and about. Even in the supermarket, you can use your trolley as a distance between where you should be between the next person. And I think that really brings me to another really important point, is that as we have seen with the developments with COVID-19 over time, there's been more and more restrictions put in place by the government. And one important thing to keep in mind is that we really should be restricting gatherings outside of our own family home or outside of our own family to just 2 people. And that's all just been put in place to try to reduce the spread of COVID-19 and really for the benefit of everyone in the community.
It's really to slow it down, and that's what this is all about, isn't it?
About flattening the curve. I'm sure you've heard about that.
Now, what preparation is being undertaken at Bass Coast Health for any influx in cases of COVID-19 on the Bass Coast?
Great. So we've been doing a lot of planning over the last few weeks, and that planning is slowly coming to fruition. So if you do visit the hospital, you know that there's been some changes. When people come to the hospital, they now have to sign in, sanitise their hands, and then also if they're coming to visit someone who's in hospital, we have strict visiting hours between 6 and 8 and only 2 visitors and a maximum time of 1 hour with those people. And that's really just to reduce the amount of people coming in and therefore reduce the amount of spread potentially. If you're a visitor coming to the hospital, you will have your temperature checked, and if your temperature is over 37.5 degrees, then you will be either told to leave the premises and seek medical attention or redirected to our assessment clinic. And that really brings me to something else that we've been doing, which I'm sure people have heard about, is the assessment clinics at both our Phillip Island Health Hub in Cowes and at the Wonthaggi Hospital as well. So that's part of our surge planning, is that we have places where people can come and have a test done if they meet the criteria. The other things we've been doing is we're doing some big moves within our hospital. So we're in the process of telling our patient's family and all our staff members about moving our geriatric population from Armitage House to Gippsland Southern Health Service, and also moving our maternity services to Foster Hospital.
And where is the Gippsland, where is the Armitage House patients going?
So they're going to either Currumborough or Leongatha Hospital, which is part of Gippsland Southern Health Service. So they're two big moves, and the reason we're doing that is so that Bass Coast Health can become the coronavirus central hospital for the sub-region. And what that will mean is that we will take all the patients that are positive for coronavirus, and by moving our existing patients out, we're creating more beds. So the aim is to flex up to 74 beds from our current bed level, and we're also doing a lot of planning around getting extra staff, so anyone from retired staff, medical students, nursing students, or anyone that wants extra work, they can go to our website and there's a expression of interest area that they can apply for extra work.
And very briefly, Renee, what are the things to look out for each of us personally if we're just not feeling quite right, and how do we know the time is to go and visit a GP?
So I think the first thing is, if you're feeling unwell, don't go to work, because even if it is just a cold or even something like the flu, it's important not to spread that to your work colleagues. If you're feeling unwell to the point where you've got lots of symptoms like a cough, a sore throat, runny nose, a good thing to do would be to visit your general practitioner, but the best thing to do is to phone ahead beforehand when you're going with those type of respiratory symptoms.
All right, thank you for being with us today. Most informative. I'm sure we will see you again sometime soon.
No worries, thanks for having me.
Dr Renee Kelsall, Chief Medical Officer for Bass Coast Health. We'll be back with regular updates and we're available at basscoasthealth.org.au and on Facebook. Until I see you again, take care.